All right, it is 2:47, and I think a good time to start. Welcome again to the 2021 UNC Water and Health Conference, and thanks for joining this afternoon session. My name is Amanda Lai from the Water Institute at UNC, and I'll be your room host today. And before we begin with our poster presentations, we do have a couple announcements. We invite you to join our networking sessions. They're every afternoon at 3:30 to 5 via Remo. And tomorrow will be our last lunch session, just as a reminder. Next slide, please. And today's networking session features a special one for young professionals interested in careers in WASH. So for those of you young professionals, I encourage you to go out immediately after this session. Next slide, please. We also have the late early show, which will be held for those of you on the East Coast like me. In the US, it'll be 10 p.m. tonight. Features Dr. Regina Suter and Alexander Winsha. They'll discuss some lessons from today and the applications in the Southeast Asia and Pacific region. And finally, if you have any questions or comments, I encourage you to put them in the chat box in the Pathable platform. So that's in that box shown in the red arrow right there. And with that, I think we are ready to introduce our first speaker. Here we have shown our list of poster presentations today. The presentations will be shown in video format, followed immediately by 4 minutes of Q&A. So I encourage you to populate the Pathable chat box as you view these presentations. So up first, we have a presentation from Aaron Best about the trends in SARS-CoV-2 viral levels in wastewater.
Good afternoon. Thank you for attending today's session, and thank you to the organizers for bringing us all together today. My name is Aaron Best. I am a professor of biology at Hope College in Holland, Michigan. Hope College is a small private liberal arts college with about 3,200 students. All of them are undergraduates. And as the pandemic went on last year, and as the college thought about coming back for an in-person semester in August of 2020, I and my research group began to think about how we could use wastewater to monitor for SARS-CoV-2 and understand the potential burden of COVID-19 on campus and in the surrounding community. I'm going to take you through a brief overview of the contents of the poster today and talk to you a bit about our strategy and then some of the results that we have. Our strategy was essentially to utilize wastewater-based epidemiology targeting SARS-CoV-2 to help us to target testing of individuals on campus to those that had an indication of a need for tests. So to do this, we divided our campus into 9 different residential zones. Each of those zones had about 90 to 250 students in them, living in dorms or cottages or apartments. We also had an isolation and quarantine zone on campus that we monitored as well. We did this monitoring 5 times per week, Monday through Friday, and we were able to report results on the same day that we collected samples. So we chose a method that allowed us to have this rapid turnaround. We felt like the rapid turnaround was absolutely critical to being able to utilize this information to make public health decisions and to communicate that to stakeholders. The method that we decided to use was called the 4S method, and it allowed us to quickly process sewage samples by the addition of salt and ethanol, a pre-filtration, and then isolation of RNA with standard DNA RNA isolation columns. This method came out of UC Berkeley in mid-August, right at the time that we needed to make a decision about what kind of process to use. This was then coupled to downstream qPCR, where we targeted 2 genes, SARS-CoV-2 N1 and the E gene. In addition to these 2 targets, we targeted peppered mild model virus, PMMOV, which we used as an endogenous control as a proxy for fecal content in the sewage. This is a virus that infects plants and it's part of our diet, and we shed that into the sewer system. We also had a process control bovine coronavirus to be able to calculate efficiency. We produced results with those three targets, SARS, N1, and PMMOV, by normalizing the SARS targets to the PMMOV targets. So we simply divided the concentration of the PMMOV was used to divide the concentration of N1 or E. This was then reported on a daily basis via an Esri-based dashboard that looks something like this. And in this panel over here on the left, you see time on the x-axis and the ratio of E or N1 to PMMOV over time. And you can see that there's variation. This reporting was critical and allowed us to be able to give decision makers some information to be able to instigate follow-up tests of residents in any one particular zone. I'd like to take you through one example of what I would call a wastewater event, where we would see wastewater signal, we would instigate a follow-up test of residents in that zone, and then be able to identify those that had COVID-19 in close contacts and remove them from the zone. This is the dashboard for a particular event in one of the zones on campus. This was an early event for us. We were not sure if this would work at all, but it did. You can see here it was a long run of non-detects for the virus in this zone, and then on day one of the event we started to see low signal. This began to increase. The white arrow indicates a decision point where we decided to increase testing inside that zone. We did not fully test the zone immediately because we weren't sure if this was going to work. You saw the signal continue to increase. The orange arrow indicates from that testing that was instigated here, the identification of students and removal of students from those zones. However, the signal did not go away, and so we instigated a full test of the entire zone. We found 5 more students that had SARS-CoV-2. They were all asymptomatic. They were removed. By this point, it took us several days to test through the zone, and then you see that the signal goes away. On day 16 here, the first students that were removed from the zone actually came back from quarantine and isolation into the zone, and you can see the signal return as they continued to shed virus. That virus shedding for students returning after the 10-day quarantine period or isolation period typically lasted about a week. That was our observation over time. In addition to monitoring the campus, we were able to monitor the surrounding community. So we monitored 3 different sewer shed zones inside Holland, Michigan and Zeeland, Michigan. It represents about 100,000 people. We did that daily all of last year, and we worked with the local health departments to identify for us case loads, daily case counts for COVID-19 in the community. And you can see in this graph here from September to December of 2020, the number of cases that were identified in any one day on the left axis, and the ratio of N1 to PMMOV on the right axis. You can see that the N1 to PMMOV ratio signal was very low. This is the red line. It was very low for much of September and then began to increase in October. Sharp increase in late October. You'll notice that the case counts were quite low for much of that time and then lag the signal that you see in the SARS-CoV-2. So we were able to determine that the lead time that is available to us, at least in this sewer shed zone, is about 7 to 10 days prior to the onset of cases. There are many reasons for why cases might lag the signal. It's not necessarily that the signal is really predating disease per se, but with many issues of testing and results and turnaround and those kinds of things, you would see a lag in this type of thing. We do believe that this is the kind of signal that one would begin to expect in a context that we're in currently, where you have sub-optimal levels of vaccination, and so over time you would be able to anticipate if you have outbreaks coming up by using wastewater signal. I will answer any questions. Thank you.
Thanks for that presentation, Aaron. We do have our first question. Were there variants of concern during the monitoring period? And if yes, did you see any differences in concentrations?
Yeah, thanks for the question, and thanks for the opportunity to present as well today. Yeah, we did monitor variants throughout, I'd say, the January through now timeframe. We're continuing to monitor now for quite a few different variants. We didn't see really effects on the total concentration that we would be looking at with qPCR data in some of these composite samples. But we could determine sort of fractions, potential fractions of variant contributing to the overall signal versus the wild type signal. And so it just sort of depends on the day. We saw beta come up and down, and currently we're seeing delta dominate most things. But we're doing that monitoring continuously at this point.
Thanks, Aaron. Follow-up question also from Colleen. Is there a dashboard for the data on campus? How do you communicate results to students and campus leadership?
Yeah, we do have a dashboard. It's fully internal. We communicate those data to campus decision makers. During all of last year, I was actually part of that decision-making team so that we had wastewater embedded on that. This year, that is not the case. So I'm communicating that up to them on every time we get the data, which is 3 times a week this year. However, that said, we are part of a larger program at this point, so we were able to sort of convince people that what we were doing on campus was effective. And so we're part of a state program in Michigan that's monitoring SARS-CoV-2 and wastewater over the next 2 years through 2023. It's a $7.5 million project for us that just started in June. And in doing so, we're expanding our monitoring from campus in the local community to about 10 to 12 counties in Southwest Michigan. So we're monitoring all of the lower part of the state. And in that context, we're producing dashboards in a couple of ways. We have an internal dashboard for partners that has real-time data coming up. And then in addition to that, we're uploading data continuously to Michigan's Department of Health and Human Services. And they have a public dashboard that should be live now, and we'll be receiving data shortly.
Great, thanks, Aaron. And Colleen has another follow-up question, and I think this will be the last question for now, but again, for the rest of the audience, if you have more questions, feel free to continue to throw them in the chat box. Colleen's question is, what recommendations do you have for convincing university campuses that this is useful and to support it?
That's a great question, Colleen, and thank you for the 3 questions. You know, I think it's totally context dependent. I've had a lot of conversations with campus leaders. We monitor from multiple campuses, not just Hope College's campus. And usually the conversation goes like, A, what is this stuff? And then B, how can it help us to understand what to mitigate COVID-19 on their campus? And what I try to convince them of is that this kind of information gives you contextual information. It's not, and if you have you know, the system broken down into enough subset zones, you can tell where your problem is on campus. You can do that in real time, essentially, so that you can anticipate what your testing needs to be or what your quarantine isolation procedures need to be downstream. But I think last year that was sort of an acute problem, and a lot of campuses understood that. This year, the conversation has shifted to more of that context, right? So a lot of campuses have a lot of students vaccinated, and they've changed their approaches this year. So it's really adaptability to understanding if they even have a problem going on at all. And then if they do, can they anticipate what to do about it? So that's how the conversation has shifted. Thank you.
Thanks, Aaron. And you have a couple questions in the chat, so I encourage you to kind of, you know, address those maybe after all the presenters are finished. And again, we encourage more questions. So in the interest of time, we'll hear next from Savannah Berger about the risks of shared wash facilities on COVID transmission.
Hello, everyone, and thank you for attending this session. My name is Savannah Berger, and today it is my pleasure to present to you a collaboration between colleagues at the University of Michigan and Emory University from this past year entitled Exploring Risk of Shared Wash Facilities on COVID-19 Transmission. So to jump right in by providing a bit of context, over 30% of persons worldwide utilize shared water, sanitation, and hygiene, which we know as WASH. Accessing water or sanitation is an essential task, even in the midst of global crises such as the COVID-19 pandemic. Shared wash facility users represent an already vulnerable population, and when considering infectious diseases, these individuals may be at increased risk due to potentially high frequency and duration of close contacts they may not have otherwise been exposed to. When considering the hierarchy of controls, as we see in Figure 1, as applied to COVID-19, we see that while total elimination using a vaccine-based strategy is the most ideal and widespread measure, other factors that may be applicable to shared wash sites, including engineering controls in the form of infrastructural adjustments and administrative controls in the form of social distancing, may also be of critical interest prior to vaccine development and continuing during the global vaccine rollout. At present, our objectives focus in particular on shared water obtainment sites, in which we are first interested in investigating COVID-19 transmission risk associated with shared water sites, and second, to examine possible improvements in conditions, both behavioral and infrastructural, which may help mitigate risk. There is a lack of empirical data to help us understand COVID-19 risk specific to shared water sites. So to help us understand this issue, our team utilized mathematical modeling as a theoretical tool to assess potential risk and risk mitigation. We do acknowledge that there are a wide range of community contexts in relation to shared water, but for clarity, we chose to build two models to represent inter and intra-community mixing associated with shared water, one generally exploring an urban context and one a rural context. In the urban structure, the focus is on intra-community mixing, where a single community may have any number of shared water sites, and residents may mix at the water sites as well as within the community. In the rural structure, the focus is on inter-community mixing, where water sites are shared among a number of distinct communities, and persons from distinct communities do not mix except at the shared water sites. The models were calibrated with disease parameters specific to COVID-19, including the latent and infectious period, and also with real-world population densities of selected urban and rural sites. The urban and rural model structures were each run to explore the outbreak dynamics under varying degrees of social distancing and degree of water sharing. Water sharing was defined in urban communities as number of shared water sites within one community, and in rural sites as number of communities sharing one water site. In both urban and rural contexts, we found that the two conditions of interest, social distancing, a behavioral attribute, and degree of water sharing, an infrastructural or access attribute, both independently changed COVID-19 attack rate, but notably had synergistic effects. Attack rate was lowest when social distancing was maximized and water sharing was minimized. Social distancing has the greatest impact when the degree of water sharing is the lowest. Although some of these results may seem intuitive, it is really important to note that the utility of mathematical models in providing the supportive evidence when empirical data is not available. We see that both behavioral and infrastructural improvements can mitigate COVID-19 risk. This is very critical at present when vaccine rollout will be underway for some time and additional measures are needed. Social distancing can reduce attack rate and is an immediate and inexpensive measure, but may be subject to compliance fatigue as any behavioral measure may be. Increasing shared water site capacity in the form of a greater number of sites and reducing users per site requires resources and time to implement, but avoids limitations of behavioral measures like decreased compliance. For ongoing outbreaks and novel pandemics in the future, policymakers and practitioners should consider these findings in conjunction with their unique regional or local contexts and available resources when making planning decisions. Our group will next explore the unique context of COVID-19 risk and shared sanitation facilities, which we look forward to sharing those findings with you at a later date. We would like to thank the Bill and Melinda Gates Foundation for project funding and our project officer, Radu Ban, for coordination and feedback, as well as our colleagues, Dr. Mandal Hassan Zahid and Hannah Van Wyck at the University of Michigan for project support. Thank you so much for taking the time to listen to our work today. If you're interested in learning more about this work, particularly about extended methods description and all model scenarios we explored, please scan the QR code on this poster with your mobile device to access our manuscript preprint. And I'll be now happy to take any questions you may have. Thank you.
Thanks for that presentation, Savannah. We do have our first question. What empirical data would you have collected for this research if that was possible to do so?
Hi, thank you for your question. That is a great question. I think that's part of the tough thing with the pandemic is that you would ideally want to know the conditions and transmission possibilities both before and during and after. And so ideally, if we could have, done an in-person study to track contacts that are happening at shared water sites and different structures of shared water sites. Because pretty much what we had to do with the models was make our best guess as to like the number of contacts that are occurring and with COVID parameters, the risk that might be occurring. So if we had actual data of real contacts to base that off of, it would have been very helpful.
Thanks, Vanna. We have 2 more minutes for questions, and as we wait for more, maybe I could just ask a clarifying question.
Sure.
How did you measure some of these key variables like social distancing, or better yet, like maybe you could clarify on the data sets that were used to build these models?
Yeah, so again, these are like mathematical models, and I actually wasn't the modeler on this project. So if the question becomes more in depth, I'm happy to share contact information. I can provide an overview though. So for COVID, we pulled parameters as of mid last year. That's when we kind of built these models. And so we were looking at, prior to many of the variants, the best estimates of incubation period, latent period, et cetera, as of last year. And then for population densities in each of the sites, we were pulling densities from very specific neighborhoods within different urban and rural sites. And then for social distancing, in each model, we varied it from, I think it was about 5 meters squared to 25 meters squared. And those were just pulled based on best estimates we could find of shared water and sanitation facilities of what would be a reasonable estimate for, the tightest packed sites versus ones that are more spread out. And so for each site, we kind of like explored a range of possible scenarios.
Great, thanks for that clarification. And that puts us at about time. But for the audience, if you have additional questions for Savannah, I encourage you to put them in our chat box in Pathable. Thanks, Savannah.
Thank you. Thanks so much.
So up next, we hear from Toussaint Kouadio about tele-coaching sanitation entrepreneurs in Cote d'Ivoire in the context of the pandemic. So bear with us 1 second. Sorry, everyone, but thanks for your patience.
Hello, dear Hal. Thank you for your presence to follow the SSD project team. The SSD project team in Cote d'Ivoire in the implementation of its activities has adapted to COVID through tele-coaching of micro entrepreneurs. SSD is a sanitation service delivery project that was founded by USAID from 2040 to September 2021 and implemented in Cote d'Ivoire and Benin and Ghana. I don't see my post-its.
Yeah, I'm sorry, Toussaint. 1 second. Our tech assistant is working through some technical difficulties right now.
Okay.
Let me try to share my screen right now. 1 second, everyone. Oh, looks like we're back up again.
Ladies and gentlemen, my name is Toussaint Yao Kouadio. I'm a water hygiene and sanitation engineer. Currently, I'm a technical advisor in sanitation and team leader on SSD projects at Population Services International. SSD means Sanitation Services Delivery. It's a project founded by USAID, the United States Agency for International Development, implemented in Cote d'Ivoire and Benin. The objective of this project is to influence the region sanitation sectors to create a more effective, efficient, and inclusive sanitation market for low-income urban residents. Achieving this goal requires especially objectives which are increase access to improved sanitation, improve safety of fecal waste containment, transport and disposal, regional learning to inform market-based sanitation program throughout West Africa. The emergency of COVID-19 in the 16th years of the SSA project has led to revision our operating strategy of monitoring micro-entrepreneurs in order to increase the resilience of the actors as well as the community in which the intervention are conducted. It's in this context that the presentation of Tele-coaching for micro-entrepreneur in Cote d'Ivoire was made. Thank you very much.
Thanks for preparing that, Toussaint, and I'm sorry about the technical difficulties, but if you wanted to take this opportunity to clarify anything that may have been cut out, please do so.
Okay. I can begin?
Yeah, sure.
Okay.
I can't see your video. I don't know if it's just me, but.
Okay. I said that thank you to your presence to follow how the SSD project team in Cote d'Ivoire has adapted the strategy to respond fraud telecoaching of micro entrepreneurs. As I said earlier in my video, SSD is a sanitation service delivery project that was founded by USAID from 2040 to September 2021 and implemented in Cote d'Ivoire and Benin. Nope, isn't my. Can I share my?
Oh, yep, sure. I'm sorry. Go ahead. Toussaint, if you're trying to share your poster, I could go ahead and do that for you.
Okay.
Oh, or we could see. Oh, yeah, that works.
Do you see my screen?
Yes.
Okay. The project aims to, SSD project aims to catalyze the private sector, like micro entrepreneurs, and create a dynamic market for on-site sanitation, capable of providing quality, affordable sanitation products to households in urban and peri-urban areas. In order to do this, micro entrepreneurs have been recruited in 15 municipalities to develop and expand product and service offering in the sanitation field. In the monitoring of these micro entrepreneurs, a central part of the SSD team's work was to provide direct on-site supervision and coaching to these entrepreneurs to diversify and improve the quality of their service offering and to strengthen the capacity of their business in sales, financial management, and customer service. It should be noted that most of them were operating informally. Then the pandemic forced us to change how we operate. Like methodology, we have made a basic level assessment on 56 micro entrepreneurs. This allowed us to develop a set of monitoring and performance indicators and to class them into 3 groups, like overperforming, performing, and underperforming. After this, we use WhatsApp and phone call to exchange with micro entrepreneurs to strengthen their capacity. For product construction and installation coaching, WhatsApp will be helpful for management coaching. Entrepreneurs and project teams exchange documentation used such as sales, events, mail, and other documents. For sales, business, and management skills coaching, WhatsApp also proved helpful for management coaching. We exchange documentation. Like results, we can see 4 graphics. We have legal formalization of activities, SAL capacities, SAL channel, financial management. Rate of micro entrepreneurs for legal formalization on the 56 micro entrepreneurs, 65% who had been caught at legal registration, and additional 5% have applied for registration in the trade register and with the tax administration. Sales capacities, 15% of the micro entrepreneurs in the tele-coaching program expanding their teams, recruiting an average of 2 artisans to support production and installation of sanitation facilities. Nine.
Hi, Toussaint. I'm sorry. I'm going to have to cut you off. In the interest of time, we're going to need to move on. But Toussaint, if you have any clarifying comments, could you maybe type them into the chat box in Pathable, and the audience can continue to interact with you there? I'm sorry about all the technical difficulties.
Okay.
Thank you for presenting, and thank you for preparing the presentation. So we will now move on to a presentation from Dennis Munai. He's presenting about public hand washing stations in response to COVID in Kenya. And just as a heads up to the audience, there is a bit of music on the video. So if you have headphones on high, you may want to consider turning it down a bit. So just 1 second as I share this screen. All right, let me start this over. I'm sorry.
We are very pleased today to facilitate the delivery of 500 water stations that will be put up across Kenya. We have already delivered 1,500 throughout the country in various counties because we recognize that one of the biggest challenges that we have here is ensuring that people are washing their hands. Hand washing, hygiene, that is the simplest thing that people can do to actually help flatten the curve here in Kenya and across the continent.
All right, thank you for preparing that, Dennis. 1 second as reorient. Right. So we are now waiting for some questions to trickle in for Dennis's presentation. In the meantime, Dennis, I invite you to share any thoughts you have or anything you wanted to expand on that may not have been covered in that.
Yes, thank you everyone for joining and for taking your time, I think, to listen to all the presentations. Something else that maybe I wanted to insist on was that, again, in Kenya, we are still in the middle of a pandemic. The needs still are there, that hand washing is still very critical. And something that we continue to realize and we continue to insist on is issues around the maintenance and the management of these hand washing stations, a supply of water, supply of the soaps. And that is something that I think we still find that, yes, the infrastructure is there, but the management part of it and the continuous operation and maintenance of the hand washing stations continues to be a challenge. But yes, we have we identified certain strategies and certain interventions that the paper actually and that the poster touches on, and those recommendations are what now we are working with our partners to see what to tweak and what to learn from. Yeah.
Thank you for sharing that, Dennis.
Yeah.
We are at time right now. So again, if the audience has any additional questions, you can reach out to the poster presenters directly. I believe their contact information is on Pathable, but if not, feel free to message me directly on Pathable and I'll make sure to find that information for you. So it is 3:30 Eastern right now, and we do have 2 networking sessions that are live. I encourage you to attend those. That concludes this session, and thanks for coming.